maternal mental health. My name is Kezia Fosuata. I serve as a policy assistant here at Groundwork, Ohio. And today I'll be moderating the conversation on Black maternal mental health, which is brought to you by Debbie Gingrich and Ashley Glass, our partners at Best Point Behavioral Health. This conversation is also sponsored by our founder, BI3, Bethesda Investments, Ideas, and Impact. We appreciate you all for taking time to tune in, and we hope you learn more about Black maternal mental health from this webinar. Before we begin, I would like to state that today's webinar is being recorded and closed captioning is available. Additionally, all participants are advised to stay muted. We encourage you to forward your questions to the Q&A box. We have a full agenda today, so if we can't get to your question during the event, we will follow up after the event if you provide your email address with the question. Lastly, all participants will be forwarded the recording of the event and its materials after the conclusion of the event. Before I begin the logistics, please know that you're encouraged to fill out the pre-survey form in the chat linked below. Additionally, please remember to follow Groundwork Ohio and Best Point Behavioral Health and our panelists on Instagram and the various social media platforms. You can follow Groundwork Ohio at Groundwork Ohio, and you can follow Best Point at Best Point Lift on Instagram. I'll begin the panel by giving a brief introduction to Groundwork Ohio and what we do. I will then introduce our speakers for the webinar and hand it over to them to take us through their objectives and presentation. I would also give a brief introduction they would also give a brief introduction on Best Point Behavioral Health. And after the presentation, there'll be an opportunity for questions. If any questions come up, please feel free to submit them to the Q&A box throughout the course of the webinar. Today's webinar is brought to you by Groundwork Ohio. Groundwork Ohio is a committed, nonpartisan public policy research and advocacy organization formed in 2004 that champions high-quality early learning and healthy development strategies from the prenatal period to age 5 that lay strong foundation for Ohio kids, families, and communities. Groundwork Ohio houses 3 centers of excellence: the Center for Maternal and Young Child Health, the Center for Early Learning, and the Center for Family Voice. This webinar is a product of the Center for Maternal and Young Child Health. Groundwork Ohio works hard to advance quality early childhood systems in Ohio by engaging, educating, and mobilizing diverse stakeholders and strategic partners to promote data-driven and evidence-based early childhood policies. I'll now hand it over to Ashley and Debbie to begin this presentation. But before I do so, I will also give a brief introduction on our various presenters. So Debbie Gingrich is the Chief Program Officer for Best Point and leads the agency's programs under Best Point Education and Behavioral Health. She earned her undergraduate degree from Miami University in Ohio in interdisciplinary studies and her Master of Social Service degree from Bryn Mawr College in Philadelphia. Debbie leads a group of over 500 mental health professionals, educators, and early childhood care providers and home visitors. Debbie oversees a total program budget of $35 million. She has led innovations for maternal mental health, created a 24-hour crisis hotline, and led the opening of a pediatric mental health urgent care. Debbie earned the Cincinnati Business Courier's 40 Under 40 Award in 2013, and she's a Bold Program graduate sponsored by the Leadership Council for Nonprofits. Thank you so much, Debbie, for joining us. Our next presenter is Ashley Glass. Ashley is a mother of 3 beautiful girls. She considers herself a health equity catalyst and creative. Ashley has a deep love for leveraging resources and advocating for mental and maternal health services for the Black community. Ashley's natural gift is critically thinking and connecting and elevating individuals who are experiencing barriers and challenges related to their health. She has a passion for empowering individuals in the community to navigate our complex healthcare system. Ashley's signature quote is, "Life is not surface level." So thank you, Ashley and Debbie, for putting this presentation together. I'll now hand it over to you to educate us on Black maternal mental health.
Okay, so I'll get started. So the objectives for today's session are to understand the experience of Black moms. We also want you all to be able to identify warning signs or symptoms that moms could be struggling with when it comes to their mental health. And then lastly, we will provide resources to address maternal mental health if you are seeing any of these signs or symptoms. So these first couple slides are just kind of painting the picture, and a lot of you all are probably aware of this. But I got these, this slide is from the Health Policy Institute of Ohio, and this just shows the disparity when it comes to maternal health. Whether it's in Appalachian counties or urban counties, it's the same. There's a huge disparity when it comes to Black maternal health. Next slide. This came from the Black Mamas Matter Alliance, and just looking at Black maternal health. So perinatal mood disorders are one of the leading complications of pregnancy and childbirth. Black women are 3 to 5 times more likely to die from pregnancy-related deaths compared to white women. 40% of Black women experience maternal mental health symptoms. 60% experience pregnancy-related issues, pregnancy-related deaths that are preventable. And then 50% for most pregnancies, related deaths occur in the postpartum period, So just some of the risk factors are, lack of social support, perceived stress, low socioeconomic status, poor access to healthcare, prior history of depression, history of sexual or physical violence, and then poor access to education. So, and those are just some of the risk factors for perinatal depression and other mood disorders. So we start out with just, so we did a study. I didn't kind of share the background. So BI3 funded us to do a study and take a look at Black maternal mental health specifically. So we contracted Design Impact, and they did some focus groups, and we had some individual interviews. We had just some stakeholders come together. But the first thing we wanted to do is understand Black mothers. So how do Black mothers even perceive mental health in general? Next slide. And I kind of said this. So these moms ranged from ages 18 all the way up to 48. These moms lived in the greater Cincinnati area, and then a qualifier was they had to have experienced a childbirth. So mothers were self-selected into focus groups, and after signing consent forms, they participated in these focus groups. So we just collected kind of the themes and learnings, and this is what we will be sharing here in the presentation today. So when we asked the moms, how do Black moms view mental health? Because we know there is a huge stigma in the Black community. So this is what we heard. These are some direct quotes. So mental health and mental wellness is your own personal peace. Finding something that brings you joy despite everything else that's going on around you. Another quote is, mental health is being completely sound, emotionally, physiologically sound. So sometimes moms didn't mention the word mental health. We have it here in the quotes, but they talked about it as just this feeling or being of having it all together, whether it is physically, emotionally, and all of that. So we wanted to kind of set the tone, and that's kind of the first thing we wanted to assess when it came to Black moms' mental health. Kind of what did they perceive as mental health? Next slide. So we noticed some perspectives showing up when we asked them about mental wellness too as well. So mental health and wellness, emotional, psychological, and affects how we think, communicate, feel, and act, how we handle different stresses, and how we relate to others and make different choices in our life. It's about everything to me. Without your brain, you can't do right or function correctly without your brain being at its best. So it's a top priority. Without having good mental health or good mental wellness, nothing else can be correct for you. So it was clear moms knew that their mental health would affect kind of everything else that was going around them. So not just themselves, but their family, balancing all of the stresses that they had going on. So they did understand mental health and how important it was to the community as a whole. Next slide. All right. So, but there's still a stigma around mental health when it comes to mental health and wellness in the Black communities. And this is another quote. So, we as Black women are often made to feel we are crazy when we're trying to express we have something psychologically going on. A lot of times we come from a background that doesn't accept mental health resources. We're told to pray it away, go to Jesus instead of working on our mental health. We have a Black community that doesn't focus on it. And it often seems the medical community does not see us as legitimately having mental health issues. And throughout our whole project, that rang true that as these women are interacting with all different people, so whether it's the medical community or their families, they didn't feel anybody was truly they prioritizing their mental health at all. Next slide. So Black mothers' mental health is deeply impacted by the strong Black woman myth. So mental health and wellness can be inaccessible as a single Black parent. For Black women, there isn't much time to rest or figure out what you need or figure out ways of support or even what that even looks like or is because of stereotypes of Black women being super strong. So that was another thing. They felt that it's perceived that they have to be strong all the time. They cannot show weakness. They can't show that they actually do need help or support. Or even if they were to share that they did need help or support, would they even really get it? Or would that put them in a worse situation? So that was shared too during our studies. So what does this mean to us? We need to meet Black mothers where they are. There still is a huge stigma around mental health and wellness in Black communities. It still exists and is compounded by that strong Black woman myth. So not only are they experiencing it in the community, it's also an internal battle too that they're facing as well. Something they're brought up with. We can't show that we're weak. We have to stay strong. We have to show that we can handle all these different stressors or situations. And so that's what we gathered from that information. So this is the slide that sticks out to me the most and was the most resounding to me with our project. And we asked the question, who cares for Black mothers? So there was an overwhelming response that they all had the same response, and that was no one. So Black mothers felt medical institutions did not do enough to identify their mental health needs and instead caused more stress. The one common form of support mothers did describe that kind of helped them were doulas. So they did mention that doulas were very helpful and helped them navigate their pregnancy experience and prioritize their wellness. But they did share when they're going into their visits and interacting with different medical professionals that they didn't feel comfortable even bringing it up if they actually were going through a mental health issue. So even if there were screenings going on or the doctors or nurses or whoever was interacting with them even asked, they didn't feel comfortable enough to truly share how they truly felt and what they were experiencing. So another key finding we found from this that the mother shared was education and access are still key to mothers' experiences with mental health and mental wellness. So Black mothers express that access to resources and knowledge should be made readily available. So sessions on mental health should be introduced for mothers. I never experienced such a thing when I was pregnant. It would have been helpful if I learned how to deal with stress, anxiety, past trauma during my pregnancy, and how it impacted me during and after my pregnancy. There are things, but you often must go out of your way to ask them. And so this was interesting too, because, working in this space, knowing all the resources that are available, it was still shocking that there are moms that still feel like they don't know of these resources, or no one has even connected them to these resources. So I like to stress this slide because I think when we work in this space and we know all the resources, sometimes we may forget that that might not be how the community feels. So even if you feel that there's a certain organization, or that there are resources out there, please make sure you're still sharing those. Don't think that the moms automatically know about them, or anything like that, because a lot of moms did not know of these resources. Next slide. Okay, so at this point, this is a self-reflection activity, and we're going to do this slightly different because we're doing an online training. So if you all could take a moment, and you can share your responses in the chat, or just do kind of a self-reflection. And if you have notebook paper, you can write it down, or just kind of think about it. But think about, with self-awareness, when you're interacting with moms, excuse me, how often are you asking moms about their mental health and wellness? Have you really prioritized their mental health and wellness? Are you more focused on different outcomes, or maybe another task that you have to do with moms, even the baby? But have you really taken the time to assess mom's mental health? Have you given her resources? Do you feel confident enough to handle a situation if you are interacting with a mom where you notice there could be some challenges going on with her? So just kind of take a moment and think about that, how she's feeling. And then we can go to the next slide.
All right, so now we're going to move on to looking at what are some of the warning signs or things that you can identify and attend to when you're working with moms. I think that what the things that Ashley's talked about are critically important in framing how we're even having the conversations and approaching the topic. I think one thing that came through loud and clear was, mom saying, even if someone asked me, I don't know if I would have told, unless I felt safe with that person. So, I think these are all things to keep in mind, and having that context of, maybe the community you're working with and historical trust or distrust of medical care systems. So having that in your mind when you're working with moms. Next slide. So again, these are just some risk factors that are associated with perinatal depression. This doesn't mean that, if a mom has some of these risk factors, it doesn't mean that she's necessarily going to develop depression. But these are just things, if you know that someone has some of these indicators in their background, that they may be more likely to experience depression. So again, personal or family history of depression. Sometimes these things, there is a biological component, history of sexual abuse. If this is an unwanted or unplanned pregnancy, current stressful life events. And I always like to caution people that sometimes we think of stressful life events as something really awful that happened, but it can also include things that are joyous but still stressful, like getting married, getting a new job, moving into a new home. Those things can be positive things, but still incredibly stressful. Diabetes or other complications during pregnancy, having low income, low family or social support, being a teen parent or single parent, pregnancy with twins or multiples, domestic violence or intimate partner violence, and a past history of abuse. So then we start thinking about what are the specific signs and symptoms of depression and anxiety. And some of these things, I think for those of us who've worked with pregnant people, you know that, well, sleep is often disrupted during pregnancy, right? Appetite often changes quite a bit during pregnancy. So some of these things we know are to be expected and are just part of a typical pregnancy. Um, but when we think about the signs and symptoms, we're really thinking about, maybe not just one thing or two things, but several symptoms, and that these persist over a couple weeks. So it's not just, one night of bad sleep here and there. It's a couple weeks I'm not able to fall asleep because I've got so many worries on my mind, and that it's causing some impact. So it's impacting their day to day somehow. Either that could be their partner relationship, relationships with other people in the family or friends, or kind of their ability to go on with their daily work or other activities. So really thinking about it in a broader context. It's not just one thing, but it's several of these things that happen over time and are creating some ongoing problems. So, depressed mood or sense of hopelessness, loss of interest in or pleasure in activity. So if you know someone who, um, always enjoyed a certain activity with friends, like maybe this is someone who enjoyed yoga or someone who enjoyed knitting or reading, if they all of a sudden are no longer interested in those things, that can be a warning sign. I also say too that with the depressed mood, sometimes we picture in our mind someone who's like in bed and can't get out of bed. That kind of is an image that comes to your mind. But it could also be irritability, especially we see this in adolescents, or younger adults. So kind of this irritability and restlessness. Again, you may see changes in sleep, either sleeping all the time or having trouble falling asleep or staying asleep. Change in appetite and thoughts of self-harm or dying. So those are all signs indicating depression. And anxiety similarly, someone who's kind of feeling anxious or on edge, excessive worrying. It's normal. I think every mom, if you talk to any pregnant person, if they're having some worries, yeah, of course they are. They worry about the pregnancy, they worry about the health of their baby, they worry about, being able to take care of baby. All those things are kind of pregnancy appropriate worries, but it's when these things are ongoing ruminations, kind of can't get it under control, and it's really impacting your day to day. Trouble relaxing, feeling real restless, kind of that keyed up and on edge, or if you're irritable or easily annoyed, and then kind of this sense of impending doom or feeling like something bad is going to happen. Those are some common symptoms of anxiety. We also want to make sure to have special note related to psychosis, especially postpartum psychosis. This is something that you will sometimes hear about in the news, around tragedies or tragic events. I just want to make sure that everyone knows if you're working with someone who may have some signs of depression, but is also having disordered thinking. So this is really the hallmark of postpartum psychosis, is really that disordered thinking, that, their thought processes that make sense, making sense, or saying things to you that don't seem grounded in reality. They may be thinking things you're like, well, that seems kind of bizarre. I wonder where that came from. Or they're responding to hallucinations, either auditory or visual, having stimuli that there's no actual data there to suggest is true. Also, you can see the mood change. Sometimes that manic mood, where someone's just extremely elevated. That can also manifest itself in like increased risk-taking behavior. So if you see, that risky kind of elevated, up all night, doing things that are just not typical, disorganized thinking, insomnia, irritability, and then that thoughts of self-harm or harming others. So if you are working with a mom who is displaying some of these symptoms, that this is a health emergency and should be treated as an emergency. This is not something that you would, I'll give you a referral and you can see someone in a month. This is something that we need to address immediately. All right, so now we're going to talk about those are some warning signs and symptoms, things to be paying attention to. And now we're kind of going to move into how we identify moms and then what kind of supports are available. So I think one of the findings as part of this work that was I guess somewhat of a surprise is that, unlike, if you go and take a child to the pediatrician, there are all of these mandated protocols for, here's the immunization schedule, or you have to do ages and stages questionnaire, and it has to be, on this interval, and you have to screen for autism. All these things that we do pretty routinely as part of routine healthcare, but there have not been real well established protocols around supporting maternal mental health. So even identifying what are those timeframes when you should be assessing a pregnant person's mental health, there's not great agreement in the community, and there are no standards of this is what you need to do. So in reading the research, we identified these three times when, at minimum, a pregnant person should be assessed for their mental health. So at that first prenatal visit, that's partly you're getting a baseline. Where are they? At least once later in pregnancy, and then of course postpartum. We always think it's the postpartum period, as Ashley mentioned earlier in the presentation. This is when a lot of those pregnancy complications occur. So we need to make sure, and a lot of times the primary health care, the OBGYN, that last visit may happen at 6 weeks postpartum, and that may not be soon enough, and it may not be late enough. So I think we need to be thinking about ongoing who's connected with mom to help screen. So in this presentation, which everyone will get a copy of the presentation after we conclude this afternoon, but we included links for some of the common screeners. These are tools that are widely accepted and determined to be valid and reliable. So the first is the PHQ-9. There is also a 2-question version. I know sometimes, we screen the moms and ask them about how they're doing, but something that we heard back from the medical community is some of these things, it's hard for them with managed care and everything that a provider has to do within a certain medical appointment. So there are short screen versions, and the PHQ-9 is 9 questions. Similarly for anxiety, there's the GAD-7, that is 7 questions. And really that's just getting you, do they hit a threshold for having depression or anxiety symptoms that is a positive screen that would lead you to refer further for care. There's also the Edinburgh perinatal depression screener. That's really helpful because it's specifically dealing with pregnancy, and pretty widely accepted and used. We also included some other links for more specific conditions. So, for example, the bipolar disorder questionnaire, obsessive compulsive inventory. Those are just more targeted if you have a specific concern about a mom related to one of those conditions that may not be detected on another survey. We also have included the Columbia Suicide Severity Rating Scale. This is very specifically geared toward assessing suicide risk. And it can be asked by any layperson. So none of these tools, and in particular, this Columbia tool does not require any special training to ask. It's just really getting at, are you having thoughts about wishing you were dead? And have you had any thoughts about that you would attempt to kill yourself? And that is including past attempts. Have you thought of a method? Have you kind of planned out how you would take your life, and then also their intent. So current intent, is this something you've thought about it and you intend to act on it? And again, also asked about previous attempts. And what we found with suicide too is very important to ask the question directly. Sometimes people will say, well, I don't want to ask the question because I don't want to put the thought in their mind. So if you're working with somebody and you're concerned, like maybe they're saying some things that are, they talk about self-harm, they have thoughts of dying, to ask the question directly, have you had any thoughts about ending your life? Um, what we have found, what the research has shown, is that just asking the question is not going to put the idea in someone's mind if they haven't already thought of it, and that you're more likely to uncover someone who's having these suicidal thoughts that you can then act to support. Most people actually do disclose to at least one other person that they're having thoughts of suicide before making an attempt. So it's important to ask the question directly, because these are preventable deaths. Also included in here, the postpartum psychosis checklist. Again, that's a very serious medical condition. There have been some questions asked, and rightly so. Are any of these tools really developed for people of color, or specifically Black women? And the answer is generally no. I think it's recognized now in the medical community that more research, and specifically more diversity in screening and trials, needs to occur. Like we heard Ashley talk about in the beginning of the presentation, how Black moms talk about depression or mental health may not be the same. What we have found through research is that diverse populations are more likely to talk about physical symptoms. And that is true too, that sometimes if someone's having a mental health condition, they talk about having a stomach ache or having a headache, and oftentimes you have physical symptoms that accompany the mental health symptoms. So we know we need to do more work in this area. There is one scale out here, the Brief Pregnancy Experiences Scale. I included that just because it is more, it was developed in this intent and purpose. Unfortunately, though, there's not a lot of I didn't find a lot of good benchmarking around when is there a positive threshold, and the reliability and validity. So in terms of community resources, I think it is really important for every practitioner, whether you are a home health worker or home visitor, that you are developing your own list of who are trusted resources in your area. Because this presentation is targeting such a wide audience, gave some ideas here about how you might find mental health providers in your area. So first thing, a good resource in every area is to search for the county mental health board. So every county in Ohio has a mental health and recovery services board where you can find information related to mental health treatment and substance use treatment. So for example, I copied there the adamhfranklin.org. That is for Franklin County. So you could go to the Franklin County board and find providers in your area. And then, those are often centers that accept Medicaid insurance and accept those that are uninsured or underinsured. You can also find providers using Psychology Today. So that is a common tool where people will list themselves as a mental health provider. That can include, it's not just for psychologists, so I think that's one common misperception, but you'll see counselors and social workers also on that site. And the nice thing about that site is you can search by what is the specialty. So if you're looking specifically for someone who is treating perinatal mental health, you can search for the specialty, you can search by location, you can search for provider by ethnicity or gender, and also by insurance. So you can be sure that, if you're treating a mom who has Humana insurance, you want to make sure that you are going to refer to a provider who takes that insurance. There is also an Ohio Mental Health America has some great resources for pregnant people. So there's the peer-to-peer support. there's a number where you can call and be able to talk to a peer. So sometimes moms, especially if there's distrust of a medical provider, feel more comfortable sharing a concern with a peer. And they also host peer groups. So that's POEM, P-O-E-M. And you can Google that and find their number and other resources. And then lastly, Health Resources and Services Administration has put out a hotline that is specific to perinatal mental health. So that 833 TLC Mama, that is a phone number, specifically a hotline for perinatal mental health. We also included in here, there was National Public Radio a few months back did a series on perinatal mental health. And so there's some links there to a story that they shared, a dad who had lost his wife to postpartum depression. Honestly, sound like postpartum psychosis. Kind of that connects, I think, on this call. Hopefully we don't have to convince people that caring for mom is the right thing just in and of itself. But also we know that the health and well-being of babies and families is directly related to the health and well-being of the caregivers. So that is critically important, that we're taking care of caregivers and not just focusing on the baby. And then also we connected a link here to the National Maternal Mental Health Toolkit. So lots of good resources there. So in closing, again, in this format, it'll be a little more challenging to have conversation, although you can use the Q&A. And it looks like there might be a few things in the Q&A, but just want you to think about, or anything that we talked about this afternoon. Were there any of those moments where you thought, oh, this is something I hadn't considered before? I'll give you my aha moment. When we first started this project, we thought, oh, well, we'll develop the screening and we'll do a pilot where we can just screen moms and, we'll be able to, quickly identify who needs additional resources. But I think that aha moment was knowing that, well, we could ask the moms, but if we weren't asking them in a safe place, in a safe space with a safe person, that we could ask all the questions we wanted, but it really would not be informative. So thinking through some of those things, what are things that we want to start doing in our approach to perinatal mental health, and also things we want to stop doing as part of perinatal mental health.
So we received about 3 questions that I have written down here. So I'll be looking down to read them. The first question is there a link to read the study that was presented earlier in the webinar? I think Ashley spoke about that.
So we do not have a link where all the information is, but if you reach out to either myself or Debbie or even Groundwork, and they can reach out to us, we can get you, we do have like a presentation that we did that has more detail from the study that we have packaged together. I'm sure we could email that to you.
Yeah, so this was not a published study. As Ashley mentioned early on, this was funded through BI3, really as a planning, part of a planning grant to see if we were to set out to transform the system of care for maternal mental health, what are those things we would need to take into consideration? So we do have like the grant summary final report.
Well, thank you for that. So the second question asks about the importance of mates in doulas. They said I think that having a doula is important because the mate plays a very important role. The Black man helps them with their role of delivery, and it's also I think I'm misreading or I'm not understanding the questions. But I think it was just a statement on the importance of the man in the doula role in conjunction to the doula, or the man playing the role as the central doula. So that was kind of a statement of the importance of support during childbirth and after birth. The second question is that you mentioned BEI3 funded to support your group. Who is BEI3, and if you can elaborate on that?
Sure. BI3 stands for Bethesda Inc., and it is a fundraising arm of Bethesda that's connected to Tri-Health. It's a major health system, and they have certain strategic priority areas. One includes maternal health and mental health, and another is youth mental health. So this is an area they are, like I said, a funding arm connected to Tri-Health, but really looking at transforming healthcare, and this is related to a couple of their strategic goals.
Thank you for that. An additional question is, has there been any steps to train doctors about how to look at Black women's health, if quote unquote, the words the individual used is, if they are not mentally there? How can doctors be present to be able to detect better if a Black woman is having a mental health crisis?
So, want me to say it, Debbie, or you?
Sure.
Okay. So that's why we developed this training, actually, is because that was what came out of the study. Women were saying there's a huge need that they felt that medical professionals do need to go through a training like this so that they can recognize the signs and build a more trusting relationship with them, so they feel comfortable enough to share if they are going through mental health challenges or barriers. And so our hopes with developing this training were we wanted to get in front of different groups, as like medical students, nursing students, you all, doulas. We did get in front of doulas, lactation consultants, that sort of thing. Anybody who interacts with moms, because that was what was brought up through the study, is moms felt like there needs to be more training so people can have that in the front of their mind when they're interacting with moms, that this is a disparity and a challenge that Black mothers face.
And part of our hopes through, this was part of a planning grant, but part of the implementation is how do we really connect to those medical training programs and ensure that these emerging medical professionals have that training, have that understanding of, from a patient perspective, from the perspective of a Black mom, what they need to really feel understood, because you cannot treat someone if your awareness and you're not in tune with what's going on.
Really, definitely. Thank you for both for such a wonderful and educative presentation. I've learned so much personally about Black women's maternal mental health, and I know the audience has as well. Currently, there's a bill in the Ohio House called House Bill 190 that designate the week of April 11th to April 17th as Black Maternal Mental Health Week, or actually as Black Maternal Health Week. I'm conflating that with our title for today. So this bill designate the week of April 11th to 17th as Black Maternal Health Week, and it's called House Bill 190. Groundwork Ohio got the chance to testify on this bill, and it was recently unanimously passed out of the House Public Health Policy Committee. And it's now in the Rules and Reference Committee, and it's waiting to be placed on the House floor for votes. So we, in light of all of this presentation that we've been educated and enlightened on, we urge you all to contact your state representatives, asking them to vote yes on House Bill 190. Once again, we urge you to contact your state representatives to urge them to vote yes on House Bill 190. You can do that by visiting ohiohouse.gov. Once again, you can do that by visiting www.ohiohouse.gov. You scroll down to the bottom of that page. There's a Who Represents Me button. You can put in your zip code and it will populate your representatives by inputting your address. And you can call their office or email them and urge them to vote yes on House Bill 190. Additionally, if you'd like to learn more about the Center for Maternal and Young Child Health, you can visit us at our website, www.groundworkohio.org/health. Pardon me, it's www.groundworkohio.org/health, and click the Join the Center's newsletter button. And you can learn more about programs such as these and more webinars and newsletters that we release regarding our various blog posts regarding maternal and young child health. So I'll end this wonderful webinar by thanking our presenters, Ashley and Debbie. Thank you so much for the time and energy you've invested in researching and listening to the needs of Black women and on the front lines, and going through this training with us. I know it is something that is going to be very impactful and will help us to be able to detect and see the symptoms of Black maternal health issues on our day-to-day lives. I would also like to encourage you to fill out the post-webinar survey that is linked in the QR code at the bottom left side. This will be very important for Ashley and Debbie's work to continue. So if you can take time to fill out this survey, post-webinar survey, that we'll be really grateful for that. You can also find a link to this survey in the chat as well. This webinar would not have been possible without Ashley and Debbie's work, and we thank them so much. We also thank you for tuning in and taking time to ask questions and to inquire more about this topic. We ask that you continue to do so. We thank you so much. We do not want to take, I know that we're ending before the estimated time, but we don't want to take too much of your day. So we thank you so much, and we hope you have a great rest of your day. Have a good day.